Imagine for a second that you were a physician and it's like the 17th century.
Oh, boy. A very different era for medicine.
Completely different.
Yeah.
So the patient walks into your clinic and they are desperately, unquenchably thirsty. I mean, drinking gallons of water a day.
Right.
And as a direct result, they're constantly running to the bathroom. But here's the thing. You don't have blood panels. You don't have lab tests.
You don't even know what a molecule is yet.
Exactly.
Yeah.
So to figure out what is slowly killing this patient, you have to rely entirely on your own senses. And that means doing something that sounds, well, utterly horrifying to us today.
Yeah, you have to taste their urine.
Ugh, I know. It is deeply jarring to our modern sensibilities, I mean, obviously. But that is exactly how early diagnostics worked. Medicine is fundamentally a story of observation.
Right, like using whatever tools you have.
Yeah, exactly. Before we could look inside a cell, we had to look at and yes, taste what the body was throwing away.
And that messy, surprisingly gross history is exactly what we are diving into today. Welcome to the deep dive, everyone. Glad to be here for this one.
So we're taking the sources you've shared with us to decode the hidden, incredibly specific language of metabolism and diabetes. We're looking at the roots glauco, gluco, and the suffix dipsia.
It's a great topic.
Our mission today is to give you, the listener, the exact meanings behind the medical words used to describe sugar and thirst and the biological reality behind them.
Because, medical terminology isn't just a static, boring list of dead words that medical students are forced to memorize.
Though it probably feels like it sometimes.
Oh, absolutely it does. But it's actually a living history. It's an evolving record of how our understanding of human biology has completely shifted from taste in urine to measuring microscopic atoms.
Which is quite the leap.
Huge leap. And once you grasp these roots, you stop seeing an intimidating wall of medical jargon, and you start seeing a logical, readable map of your own body.
I love that. So here's our game plan for this deep dive. We're going to trace two identical word roots that somehow drifted apart, then examine the specific suffixes that describe how our bodies experience thirst.
And we'll get back to that historical medical taste test that tied all of these biological concepts together.
Yes, the taste test. But first, to understand how modern medicine talks about sugar, we actually have to start in ancient Greece and then take a detour through a 19th century chemistry lab in France.
It's a brilliant etymological journey, honestly.
So where do we begin?
Right. So the foundation for almost all medical language regarding sugar is an ancient Greek word glyces, spelled with a Y, which simply meant sweet.
Not sweet. Nothing too complicated.
Exactly. For centuries, if a physician wanted to describe anything related to sweetness or sugar in the human body, that was the go-to root.
But when you look at a modern medical chart, you don't just see one root for sugar.
No, you don't.
You see two completely different spellings. Like you see glyco with a Y and you see gluco with a U. They're both combining forms, meaning sugar or sweetness.
Yeah, and the sources point out that this is a notorious gotcha moment for medical terminology students.
Oh, I bet.
It absolutely is. I mean, a first-year student will look at glyco and gluco, assume they must mean completely different things biologically, and try to memorize them as unrelated concepts.
Which is a nightmare.
Right. But etymologically, they trace back to the exact same ancient Greek word. They are identical twins.
Okay, let's unpack this. So they are basically identical twins, but one went to art school and the other went to chemistry lab.
Actually, that's not far off.
But if they come from the exact same word and they fundamentally mean the exact same thing, why on earth does modern medicine need two prefixes?
It seems redundant.
It feels like they're intentionally making it confusing. Why not just pick one spelling and toss the other?
Well, what's fascinating here is that we actually couldn't toss one because as science evolved, our need for precision demanded both.
Demand? How so?
You have to picture what was happening in 19th century France. The science of molecular chemistry was just exploding. French chemists weren't just looking at the broad concept of sweetness anymore. They were looking through early microscopes, calculating molecular weights.
Oh, wow.
Yeah, they were isolating the primary physical sugar molecule that drives human metabolism.
Right, so they are literally extracting the physical substance in the lab.
Exactly. And when they isolated that specific molecule, they needed a name for it.
Makes sense.
So they took that ancient Greek root glyces, but they filtered it through French pronunciation and the new rigid naming conventions of chemistry. And they recoined it as glucose with a U.
So the U is essentially a French chemistry stamp of approval.
That's a great way to put it, yes.
But I'm still stuck on how we use them today, like for regular patients? Are they just interchangeable synonyms now?
Not quite. I mean, they are not perfectly interchangeable, but they aren't perfectly separated either.
Sounds complicated.
It's what linguists and clinicians call a soft division of labor.
A soft division.
Right. We needed one word to talk about sugar as a broad systemic environment in the body, and we needed a slightly different word to talk about the specific, isolated chemical molecule that those French chemists discovered.
Oh, okay. So they are identical twins, but it's like one became an ecologist studying the overall health of the forest, and the other became a botanist studying the cellular structure of a single leaf.
That is a perfect way to conceptualize it.
Thanks.
So let's look at how modern medicine actually divides that labor, starting with the ecologist twin, glyco with a Y.
The forest.
The forest. This root describes sugar as a physiological state, a bodily environment, or a broad class of molecules.
And the sources give us some great examples of this environmental focus. Take glycemia, for instance.
Right, so the suffixemia means a blood condition.
So glycemia isn't a molecule. It's simply the general state of sugar circulating in your blood.
Exactly, and consider glycogen.
What's that one do?
Well, when you eat a heavy meal, your body has more sugar than it can use in that moment.
Like after Thanksgiving dinner.
Yep, exactly. The liver takes that excess sugar and packs it tightly together, like folding clothes into a suitcase, to store it for later.
That's a helpful image.
That broad, stored package of sugar energy is called glycogen.
So it's still about the Y spelling. And when things go wrong in the body's environment, we also use the Y, right?
We do. Yeah.
For example, glycosuria. The suffix urea refers to urine, so this is the condition of having sugar spilling into your urine.
Which brings us back to our 17th century doctor.
Right, or hyperglycemia. Hyper meaning high, so an environment of high blood sugar.
Precisely. When a doctor says you have hyperglycemia, they are telling you about the status of your internal ecosystem.
Not a specific molecule.
Right. Your blood has become too saturated with sugar. They aren't pointing at a single atom. They are diagnosing the state of the forest.
Which perfectly sets up the chemistry lab twin, gluco with a U.
The botanist.
The botanist looking at the single leaf.
Mm-hmm.
And the sources say this one is incredibly specific.
Far more specific and deeply chemical. When you see gluco in a medical term, it is almost exclusively pointing to the molecule glucose.
Yeah.
Carbon 6, hydrogen 12, oxygen 6.
C6H12O6.
That's the one. That is the fundamental unit of energy for human cells.
It's the physical fuel itself.
Yeah.
And you see this specificity in words like glucogenesis.
Which is just the creation of glucose molecules.
Or my favorite one from the sources, because it sounds incredibly intimidating until you break it down. Gluconeogenesis.
It's a brilliant word, actually.
Break it down for us.
Sure. So gluco for the specific molecule, neo for new, and anagenesis for creation. The creation of new glucose.
Wait, if my body already creates glucose from the food I eat, why does it need a special word for making new glucose?
Oh, this is where the biology gets incredible.
What's the mechanism there?
Well, normally your body breaks down carbohydrates into glucose, like you said. But what if you are starving?
Okay.
Or what if you are running a marathon and completely deplete those glycogen suitcases we talked about?
The body's out of stored fuel.
Right, but your brain still demands C6H12O6 to survive. It has to have it.
So what does the body do?
Your liver performs a biochemical magic trick.
I love magic tricks.
It takes non-sugar substances like amino acids from your muscles or glycerol from your fats and chemically reverse engineers them into brand new glucose molecules.
Oh, wow.
Yeah, that emergency chemical synthesis is gluconeogenesis.
That is amazing. It's essentially the body turning its own structure into fuel because the molecule is that critical.
Literally breaking itself down to keep the brain running.
But, thinking about these two routes side by side raises a practical question for me.
Let's hear it.
If I'm a patient monitoring my diabetes at home, I prick my finger and use a device called a glucometer.
Right.
But I'm using it to figure out if I have hyperglycemia.
Yeah, the Y word.
Exactly. Why isn't the device called a glycometer?
It's because of exactly what the device is doing inside its plastic casing.
What do you mean?
The device isn't diagnosing a disease. The device is a highly calibrated chemical sensor.
Oh, I think I see where you're going.
When you put a drop of blood on that test strip, an enzyme reacts exclusively with the C6H12O6 molecules. It is literally counting the individual trees.
It is performing molecular chemistry.
Yes. Therefore, it is a glucometer.
Oh, I get it now. The tool measures the specific molecule, but the human doctor interprets that number to diagnose the overall state of the body.
Exactly. A glucometer reading of 250 milligrams per deciliter is a chemical fact.
Right.
The doctor looks at that fact and says, your bodily environment is out of balance. You are in a state of hyperglycemia.
That makes so much sense. Now, if your body enters that state of hyperglycemia, if your blood is heavily saturated with sugar, your body doesn't just sit there quietly.
Oh, definitely not. It reacts.
And one of the primary ways it reacts is with an intense, often desperate physical craving, which brings us to the biology of thirst and the suffix dipsia.
Thirst is a fascinating mechanism. It is your brain's alarm system alerting you that your internal environment is compromised.
But why does high sugar trigger that alarm?
It all comes down to a fundamental principle of biology: osmosis.
Osmosis. I remember this from high school science, vaguely. It's about water moving across a membrane to balance things out, right?
That is spot on.
So how does the sugar act in the blood during osmosis?
Think of glucose as a microscopic sponge.
Okay, a sponge.
When you have hyperglycemia, your bloodstream is packed with these sugar sponges. But the cells surrounding your blood vessels need a very precise balance of water to function.
Right.
Because there is so much sugar in the blood, the forces of osmosis literally drag water out of your cells and into your bloodstream to try and dilute all that excess sugar.
Wait, so the high blood sugar is physically dehydrating your body's cells from the inside out?
Precisely. Your cells are shrinking. They are losing their water to the bloodstream.
Wild.
It is. And when those cells dehydrate, they send a frantic chemical signal to a tiny region in your brain called the hypothalamus.
And what does the hypothalamus do?
It receives that panic signal and translates it into a conscious, undeniable urge. Drink water immediately.
And in medical terminology, that condition of thirst is captured by the suffix dipsia.
Exactly.
But the sources emphasize that dipsia is almost never used by itself. I mean, a doctor isn't just going to write thirst condition on a chart.
No, because simply stating a patient is thirsty gives zero clinical insight. Everyone gets thirsty.
Fair point.
The doctor needs to know the magnitude. They need to know the extreme.
Right.
They need a prefix attached to dipsia to measure the severity of that biological alarm.
So what does this all mean? Let's create a scale for you listening. If the human thirst mechanism is like a volume dial on a stereo ranging from 0 to 10, the prefixes tell us exactly where that dial is set.
I like this analogy.
Let's start at the extreme high end. If a patient's cells are dehydrated by sugar and screaming for water, that dial is cranked all the way up to an 11.
And the medical term for that 11 is polydipsia.
Poly meaning excessive.
Yes. The prefix poly means many, much, or excessive. So polydipsia is a condition of excessive, unquenchable thirst.
Like our 17th century patient.
Exactly. The patient isn't just asking for a glass of water. They are drinking straight from the tap and still feeling parched.
Because the underlying osmotic pull of the sugar hasn't been resolved.
Spot on.
Then, if we turn that volume dial down to, say, a mere whisper of a signal, we get oligodipsia.
Oligo is a prefix meaning scanty, few, or deficient.
So what does that look like in a patient?
A patient with oligodipsia has a deficient sense of thirst. Their body might genuinely need water, but the signal generated by the hypothalamus is just too weak to register properly.
So they have to, like, actively remind themselves to drink.
Exactly. They won't feel thirsty even if they are dehydrated.
But then there's a condition where the volume dial isn't just turned down. The speaker is completely unplugged.
Yeah.
A 0.
Yeah, and that prefix distinguishes itself entirely from poly and oligo.
Right, it is a dipsia.
The prefix a means without or absence of. Adipsia is the complete absence of the thirst mechanism.
That sounds dangerous.
It is an incredibly dangerous neurological condition. I mean, a patient's cells could be desperately dehydrated, their blood volume could be dropping.
No.
No. Because of trauma, a tumor, or a defect in the hypothalamus, the brain simply never consciously registers the need to drink. The alarm system is completely broken.
Wow. The volume dial analogy really puts it into perspective. Having precise language for the magnitude of a symptom gives the doctor the parameters of the puzzle.
Yes, exactly.
When a patient comes in complaining of polydipsia, the doctor knows the alarm is blaring at an 11, but they still have to figure out why.
And the why is the whole job.
Right. Is it a brain issue, a kidney issue, Or is it that heavy glyco-blood environment pulling water from the cells?
And determining the why behind that excessive thirst is one of the most famous detective stories in medical history.
Which brings us right back to our 17th century physician.
It does.
Here's where it gets really interesting. Let's say our historical patient is presenting with severe polydipsia. They're drinking constantly.
And as a direct result, their body has to eliminate all that fluid, so they are urinating constantly.
The physician needs to know if this is a sugar problem. But without a glucometer to measure the specific C6H12O6 molecules, how do they check for hyperglycemia?
Well, they look at the downstream effect. If the blood is overwhelmed by sugar, the kidneys, which act as the body's filtration system, are also overwhelmed.
Well, they can't filter it all out.
Right. The kidneys can't reabsorb all that glucose, so it inevitably spills over into the urine.
Oh, and this is the condition we defined earlier, glycosuria.
Exactly.
So the physician tastes the urine, and if it's sweet.
If it's sweet, they have their answer. The excessive thirst is being driven by a systemic sugar imbalance.
Wow.
And this specific diagnostic taste test is actually responsible for naming the disease we still talk about today, diabetes mellitus.
Diabetes comes from a Greek word meaning to pass through, like a siphon, right?
Yes, it refers to the constant drinking and constant urination. The water is just siphoning right through the patient.
And mellitus comes from the Latin word for honey or sweetness.
So literally the sweet siphon.
The sweet siphon. That's poetic in a very gross way.
It really is. The sweetness confirmed the presence of sugar, making it a glyco problem.
But the sources mention that the reason this physical taste test was considered absolutely vital clinical work and not just a bizarre quirk of history is because of another disease.
Yes, a condition the sources refer to as the great imposter.
The great imposter. Why is it called that?
Because it completely mimics the symptoms of diabetes mellitus.
How so?
The great imposter condition is known as diabetes insipidus. A patient with this disease also walks into the clinic with severe polydipsia.
So they are desperately thirsty too.
Right. The alarm is at an 11, and they are urinating constantly. If a historical doctor simply looked at them, they looked exactly like a patient dying from a sugar imbalance.
But they aren't. What is actually happening in their body then?
Well, their blood sugar is completely normal.
Wait, really?
Yeah. There is no osmotic sponge pulling water from their cells. Instead, the problem lies entirely with a hormone called ADH, or antidiuretic hormone.
What does ADH do?
Normally, ADH tells your kidneys to hold on to water so you don't dehydrate.
Okay, that's important.
But in diabetes insipidus, the brain fails to produce ADH, or the kidneys just fail to respond to it.
Oh, wow. So the kidneys floodgates are just stuck wide open.
Precisely. The kidneys are completely incapable of concentrating the urine. They just dump pure water out of the body as fast as the patient can drink it.
That is terrifying.
It is.
But if you were a doctor in the 1600s,
Yeah?
and both patients have polydipsia and constant urination, how could you possibly know whether the patient had an insulin or sugar failure versus an ADH hormone failure?
You taste the urine. When the physician tasted the urine of a patient with the great imposter condition, there was no sugar spilling over. It wasn't sweet like honey.
Because it's just pure water.
Because the kidneys were just dumping pure, unconcentrated water, the urine was heavily diluted and utterly tasteless.
Tasteless. And the medical or literary word for something lacking flavor is insipid.
Hence, diabetes insipidus, the tasteless siphon.
That is absolutely mind-blowing. The medical vocabulary we use today, mellitus versus insipidus, isn't just arbitrary Latin.
Not at all.
It is literally an artifact of historical doctors trying to solve the biological puzzle of polydipsia using nothing but their taste buds.
Yes.
I know we said medical history is gross, but you genuinely have to respect the sheer resourcefulness of those early physicians.
You truly do. It is the ultimate proof that you cannot separate the language of medicine from the history of medicine.
They are completely intertwined.
Completely. The words themselves contain the diagnostic journey. A patient comes in with excessive thirst. Is the cause a glyco problem resulting in sweet urine?
Right.
Or is it an ADH problem resulting in tasteless urine? The vocabulary captures the evolution of how we learn to tell the difference.
And I think that brings us to the most important takeaway for you listening right now.
Yeah, the real practical application.
Understanding the difference between glyco, gluco, and dipsia isn't just about passing a biology pop quiz.
Or having a weird trivia fact about urine to share at a dinner party.
Though it is a great trivia fact.
Oh, for sure.
But really, it is about power and clarity when it comes to your own health.
Absolutely. The next time you are sitting in a clinic and you see these terms on a chart or an app portal, You don't have to feel overwhelmed.
Right, because you know what they mean now.
When you know that glyco describes the broad environment of your body, that gluco describes the specific chemical fuel your cells need, and that dipsia measures the exact volume of your body's neurological alarms, the jargon melts away.
It really does. You aren't staring at a foreign language anymore.
You are reading the instruction manual for your own biology.
It empowers you to ask your doctor better questions, honestly. If you see hyperglycemia, you know your internal ecosystem is out of balance.
Yes.
If you see a glucose reading, you know exactly what molecule the lab is counting. You hold the map.
My final thought on these sources is a simple reminder that language is always playing catch-up with scientific discovery.
How do you mean?
Well, we started with one simple Greek word for sweet. But as our technology evolved from human taste buds to molecular sensors, our understanding deepened.
We needed more words.
Right. We realized the body is wildly complex, and our language had to splinter and adapt to capture that beautifully complex system.
And that leaves us with a fascinating final thought for you to mull over. Today, we learned how one ancient word for sweet split into two completely different scientific prefixes, glyco and gluco, simply because our technology for measuring reality got better.
We could suddenly see the molecules, so we needed a new word for them.
It really makes you wonder, what broad, everyday health terms are we using right now that 100 years in the future, doctors will have split into entirely different, hyper-specific medical diagnoses?
It's a great question.
When doctors look back at our precise maps of the human body, will our words seem just as blunt to them as a 17th century taste test seems to us today?
I wouldn't be surprised.
Thanks for joining us on this deep dive. We'll catch you next time.